Should sperm or egg donation recipients get genetic screening? Imagine building a family with the help of donor sperm or eggs. Have you ever wondered if you should check your own genes before choosing a donor? Well, that's what we're exploring today. Genetic screening is a test that looks for changes or mutations in your genes. These mutations can cause inherited health conditions. Many genetic disorders are recessive, which means a child needs to inherit two copies of a mutated gene, one from each parent, to be affected. If only one parent carries the mutation, the child usually won't have the condition but might carry the gene. When using donor sperm or eggs, you introduce genetic material from someone outside your family. Donors are screened for many common genetic conditions, but no test can catch every possible risk. That's why it's important for recipients to understand their own genetic risks. Knowing your carrier status helps you and your doctor make better choices. In the United States, regulations requiring egg and sperm donors to pass medical, infectious disease, and genetic testing. This includes screening for a panel of common genetic disorders. But it doesn't test for every condition. The goal is to reduce the chance of passing on a genetic disease, not eliminate all risks. Recipients are not legally required to get genetic screening, but most fertility clinics and medical groups strongly recommend it. When you know your own carrier status, you can compare it with the donor's results. If both of you carry mutations in the same gene, there's a higher chance your future child could inherit a disorder. Here's what you can do if you're considering donor sperm or eggs. First, get carrier screening for yourself and your partner if you have one. This test checks for mutations linked to common genetic disorders. Next, review the genetic screening results of potential donors, which reputable banks provide. Working with a genetic counselor can help you understand what the results mean and how they impact your choices. If you find out you and a donor both carry the same mutation, you might choose a different donor to lower the risk. This process isn't just about avoiding disease. It's about making informed decisions for your family's health. Even without a family history of genetic issues, you could still be a carrier. Screening gives you more control and peace of mind. Some worry that testing might limit options or cause stress, but it often helps you find the best match and reduces uncertainty. It can also reveal important health information for your own future. Remember, directed donors still need to pass the same screening as anonymous donors. The process might be more flexible if everyone understands and accepts the risks. If you create embryos from your own eggs and sperm, those aren't subject to donor screening, but if you donate those embryos later, screening is recommended. Genetic testing technology keeps improving, but no test is perfect. It can't guarantee your child will be free of all genetic conditions. Still, screening significantly lowers the risk and is a responsible step in family planning. In the end, getting genetic screening as a recipient of donor sperm or eggs is a smart move. It helps protect your future children and supports making choices you can feel good about. If you're thinking about using donor material, talk to your doctor or a genetic counselor. Taking this step can make a big difference in your family's health journey.